Shifting to the side, lateral leg, let's ride. Two key muscles here standing with pride. Fibularis longus and brevis below. Effort in that foot, watch the movement flow. Superficial fibular nerve keeps them in the game. Learn their every move, whisper in their fame. Lateral leg, ever with flair. Superficial fibular nerve beyond compare. L5S, fibularis longus and brevis so keen. Aversions their function, a powerful scene. Plantar flexion, help from longus you'll find. These muscles together, one of a kind. Fibularis longus aprilis, if you please. From fibula's head and proximal 2/3, it starts with ease. Lateral tibial condyle also lends a hand. Its tendon runs down across the foot's land. Posterior to lateral malleolus, it takes a dive. Crosses under the foot, keeping arches alive. To medial cuneiform first metatarsal space. Eversion plantar flexion at a steady pace. Supports transverse and lateral arch, a vital role it plays. Superficial fibular nerve. Lateral leg, ever with flair. Superficial fibular nerve beyond compare. 5S, fibularis longus and brevis so keen. Aversions their function, a powerful scene. Plantar flexion, help from longus you'll find. These muscles together, one of a kind. To longus fibularis brevis resides. From distal 2/3 of fibula's lateral sides, its tendon descends. With longus it will race behind lateral malleolus, finding its space. To tuberosity of the fifth metatarsal it makes its way. Eversion of the foot, come what may. Superficial fibular nerve, the message it sends. This muscle's tendon most commonly dislocates, my friends. And the Jones fracture, avulsion at its base. Fibularis brevis pulling, a common case. Ever with flair. Superficial fibular nerve beyond compare. 5S, fibularis longus and brevis so keen. Aversions their function, a powerful scene. Plantar flexion, help from longus you'll find. These muscles together, one of a kind. Fly long, superficial fly boy is the key. Fibularis longus, superficial fibular nerve. Fibularis brevis, you agree? Common fibular nerve, find it with care. Tween parts of longus from fibula's head, it's there. If that superficial fibular nerve gets a lesion, aversion's restricted, a painful concession. Lateral foot edge first, when patients take a stride. Lateral calf atrophy, nowhere to hide. Lateral leg ever tours, now you're in the know. Fibularis longus and brevis steal the show. Keep that knowledge building, future docs stand tall. Mastering this anatomy, you'll conquer all.